think everyone has completed their pre-test. But my name is Sage. I was a dental assisting student with Natalie. I think it was your first year teaching, wasn't it?
Mm-hmm.
Yeah. So I was a dental assistant here at Wasatch when I was a senior in high school. And currently I am a senior in dental hygiene school at Utah Tech. And I'm just here to talk to you guys about the transition between dental assisting and dental hygiene and just kind of the stuff I did in between to get there. Because I asked Natalie and she said a lot of you would be interested in learning about some dental hygiene. And I remember going into dental hygiene school and thinking, oh yeah, it'll be easy. I did dental assisting school and then I was humbled just a little bit, so. Just a little bit about me. I graduated from Wasatch High School in 2021. I was one of Natalie's students. I was an intern at Dorius Dental Design, or whatever it's called now. I know Smile something,
Yeah.
but I know Dr. Proctor's a little bit more involved now instead of Dorius. And then between when I got into the dental hygiene program and just in summers and things, I worked at Red Rock Oral and Facial Surgery. This was a oral surgeon office down in St. George. And I'm a current Utah Tech senior in their dental hygiene program, and this is my capstone. This is why you've probably been hearing a little bit about me, is because I do a lot of stuff to prep and get ready for everything. But basically what a capstone is it's kind of my big final project that I do. I have a whole class dedicated to it, but it's kind of similar. If you get a master's degree, you have a thesis. If you get a bachelor's degree, you have a capstone. Kind of the same thing. And I took my National Board of Dental Hygiene 6 days ago. That is that big test that you have to take. I had to go to Vegas to take it. It took me, they give you 9 hours to take it. It took me 6. It's about 350 questions. So it's a pretty involved test.
You guys are freaking out over yours.
Makes you feel any better, it won't. The NCLEX, so this is the NBDHE, the NCLEX is the one for nursing. It's 150 questions max. So, isn't that funny? And then just a little bit about why I picked to go to Utah Tech. I really liked Heber, but I wanted to move somewhere away from my family for a minute to have kind of a little fun adventure. And then I knew I wanted to do something in the medical field, which is why I picked dental hygiene. I remember one time I went and got a filling done when I was thinking about it, and I was like, there's no way, I never want to do anything like this. And then I found out that that was wrong. I also didn't really like how nursing had night shifts and nursing eat their young, kind of all that stuff. I didn't love a ton, but I offered that dental hygiene doesn't have any night shifts. I thought that was really great. And then the more I learned about dental hygiene, the more I actually really liked it because I found how much it's focused on preventative medicine. It's kind of one of the only specialties that's completely focused on prevention. And then I also picked Utah Tech because I wanted a bachelor's degree. I did the Spanish Bridge program. I was in the first year of students that did that. And so I wanted to be able to graduate with a minor as well, and you can't graduate with a minor with an associate's, you need a bachelor's. And then I also wanted to be trained in expanded functions. This is something that you are trained in at Utah Tech. They teach you how to do fillings because all of our border states do allow expanded functions. It was just past Arizona, Nevada, and then it's also legal in Colorado as well. There's actually a bill going through the state right now that will make it so dental assistants and dental hygienists can perform expanded functions. They're trying to work out the rules and everything for that right now, but it's actually pretty likely that that bill is going to pass. And so I just wanted to be trained in that just in case wherever I needed to go if I needed to do that. And just a little disclaimer, I tried to do all my research on all the different topics, but I definitely know the most about Utah Tech because I've been there for 4 years. So I'm a little bit biased. I tried to make it as least biased as I could by research like Utah College of Dental Hygiene, UVU, Fortis, all of those. And then I just wanted to find a little bit about you. I was wondering who is interested in being a dental hygienist. Awesome, quite a bit of you. I remember when I had about 10 people, maybe 8 in my class by the end of it, and 2 of us I know are in dental hygiene school right now, me and Kelsey, and one of us switched to nursing, and a couple others are doing nails and stuff, but it's really fun. It's a fun career. And then do they want to share why they want to be a dental hygienist?
I want to be a mom, so I think just having a good schedule would be really
I'm
great for that.
gonna be honest, that's why just about half, maybe more of the people that I've had have picked dental hygiene because the schedule is so great for kids.
Yeah.
Anyone else?
I'd probably say the same thing.
It's really great for your schedule. You also get to be involved. You're also what's called a mid-level provider. So even though you can't technically diagnose things like periodontal disease, you still know how to. Kind of the same with dental assistants. Have you ever taken a PA and they're like, what's wrong? It's like, well, I see an abscess, but I can't tell you that. I'm not gonna say anything. And then does anyone want to share what their favorite part about working in dentistry is? I know a lot of you said that you like connecting with your patients. You guys are all doing your intern hours right now, right? Yeah, super fun. Are you guys almost done? Or close?
Some of them are, some of them not.
Yeah, it's rough, it's hard. I remember doing that. I would try and schedule myself as much as I could, but I think I wasn't close until the end of April either, so. Just a little bit about what we're gonna talk about today. I have 3 objectives for us, but our goal is to be able to make sure that you guys can understand the necessary prerequisites of becoming a dental hygienist. I know you guys talked a lot about that's what you were curious about. And then also learning a little bit about educating our patients. There's a lot of ways that we can actually make them feel a little bit more confident as if it was almost their idea instead of you're telling them what to do. And then also being able to feel knowledgeable about the basics of dental hygiene. I remember, like I said, I was thinking oh, this will be so easy, and then I would just learn things and I was like, that's a lot harder than I thought. And then also creating an action plan, because although I'm talking about dental hygiene, there's really so many things that you can do in dentistry especially. It seems like it's kind of limited, but I've actually been able to see that it expands quite a bit. This is something that I wanted to include. This is a graph that we gave to the CNAs when we were presenting to them, but it's just talking about the whole mouth and body connection, just to make us feel, because I feel like everyone's like, why did you even pick teeth? That's something my little sister asks me all the time. And I like showing people this graph. I actually showed my parents last night and they were shocked by all of it. But the Surgeon General, which is kind of the big group of doctors that decides a lot of stuff for the country, they report that at least 80% of American adults have gum disease or periodontal disease as we know it. And the impact can go far beyond the mouth. Does anyone want to share something that surprises them? I know it's a little bit more than you expect.
Top right one is pretty
Yeah, stroke. People with gum disease are 3 times as likely to develop a stroke. The most common ones that are involved with periodontal disease is stroke, heart attack, and also there's a lot of studies coming out about Alzheimer's disease. They believe that Porphyromonas gingivalis, the bacteria that causes gum disease, is actually found at a higher rate in the brains of patients with Alzheimer's. Also, there's a theory that believes that the periodontal ligament, the thing that allows us to feel things when they're chewy, is also having constant stress like that is actually better for our brains and can help decrease the risk of Alzheimer's. The first thing I want to talk about is prerequisites and applications. I know anyone who filled out that survey talked about how it was something that they're really interested in, and I heard a lot of things when I was applying. Someone told me oh, I thought you had to be a junior before you could apply. That's not true. I had someone else who was oh, I can just take 1 semester and then apply. I mean, that you probably could, but you'd have to take almost 30 credits to do it, but just talking about that a little bit. Just a few generals and prerequisites. These are kind of ones that are required by most universities in order to obtain any sort of a degree. So when I took these classes, I had a lot of I had mechanical engineering people in my class, communications, art, any of them, they were all surrounded by me. But just things like English, American history, art, sociology, humanities, and biology is kind of a good background for when you start to get into the slightly more complex classes. But those major specific requirements, so in these classes you have more of those health science majors involved in there. So that would be your nursing students. I was really close with a lot of nursing students when we were all doing our prerequisites together. Exercise science is also really common, pre-physical therapy, things like that. But those would be nutrition, human development, interpersonal communications, which is when you're learning to talk one-on-one with a person, intro to statistics, human anatomy, and also a lab. That's your cadaver lab, where you go in and there's a dead body and you have to learn how to identify all the muscles in the body and all that stuff too. Physiology is another one. There's a lab for that as well. You get to put electrodes on your brain, track your brain waves. That one's kind of fun. And then chemistry as well. This one, the one that I took specifically at Utah Tech is a specific one for health science. Some of them are, sometimes it's like a general chemistry, but it can kind of depend depending on where you apply. But the first little activity that we're going to do is something talking about all these different prerequisites. I do have 6, so some of you have 2. But that little sticky note that I put on your desk, I want you to talk to your partner and read that story and figure out which of the 6 classes it would be involved in. And when you think you know it, I want you to read it to the class and then put it on the board. Some of them are tricky, I know. It's okay.
We have a question.
Yeah.
We're not sure what
Maybe I probably just finally see them. Sorry. I had the ones that were slightly better written out. I realized I left them at my house, so they're on sticky notes now.
Okay.
Yeah.
Right now?
Yeah, sure. Yeah, just read it. Sorry.
Okay, you're about to give a patient an inferior alveolar block. Which class would help you identify landmarks? You said anatomy?
Yep, that's right. Yeah, you learn lots of stuff about anatomy. I would get really frustrated because I'd say, why do I need to know every muscle in the foot to clean teeth?
Yeah.
But it's a little bit more generalized.
Okay, ours says your patient is a smoker and they have a deficiency in vitamin C. Where's the nutrients?
Yeah, nutrition's pretty heavily involved. You do a lot of nutritional counseling and dental hygiene.
Ours says your patient has multiple 5 mm buckets and has been diagnosed with periodontal disease. Which class would help you explain it to her? Lisa, in-person communication.
Yeah, that's right. Some of them are a little bit tricky.
What is yours?
You can get it wrong, I promise.
I'm not gonna fail you.
Natalie has no idea. She can't even read.
Ours says your patient has informed you of a new study that says they only need to brush 1 time a day. Which class would help you evaluate this study? And then he said physiology.
The correct one is actually Intro to Statistics. What that one will teach you is how to read a study and how to look at the numbers and make sure that it's all looking right. That's a really good guess though. You're not wrong. I made these tricky on purpose. Okay, we got physiology. Physiology is a little bit more like almost microscopically what happens to the cells when you do certain things.
Okay, your patient asked you how local anesthesia works. Which class will help you know how to explain this?
That is correct. You actually learn a lot about how the nerve conduction happens and the whole process of that, so that can also be involved as well. And there's one more. What does yours say?
Mine says your patient states that she would like
Hydroxyapatite?
instead of fluoride, which class would help explain how fluoride works.
Yep, that is chemistry. So, have you guys heard about hydroxyapatite a little bit? It's in the No BS toothpaste. Maybe that's just my TikTok, 'cause this is all I talk about all day. Listening to me. But it's kind of a new alternative to fluoride, and a lot of people, I feel like, are using it as a, well, it's so much better for you, right? But actually what ends up happening in the formation of fluoride is hydroxyapatite and fluoride combine to make fluorapatite, which is more resistant to acid in the body, in the mouth. So that's kind of something that I've had conversations with a few people before. Just a summary of what we talked about. I remember just getting really frustrated when I was taking my prerequisites. I remember being frustrated and saying like, why do I have to know this to clean teeth? Why do I have to know how the stomach works? Why do I have to know all of that? I especially learned this when I took like pharmacology and things, because you have to learn about a lot of different medications. I remember being like, oh, I understand now, because in order to understand how, let's say, omeprazole works, which is an anti-nausea drug in the stomach, you have to know how the stomach functions to know how it works in your mouth as well. The most common side effect is xerostomia or dry mouth. Another one that's really important is learning all the muscles of the face, because in that same bill that I talked about that's currently working on getting passed, it also involves hygienists being allowed to do Botox. So that's really exciting. In Utah, you have to at least have your RN. And I know a lot of nursing students, they talk about, oh yeah, I remember learning the muscles of the face. We spent a whole day on it. I spent a whole class, a whole semester learning it. I took a board review in February with someone who is from Arizona. Her name is Katrina Sanders. She's kind of a famous dental hygienist, but she was talking about how she was learning to do Botox, and she took a class with dermatologists, doctors, primary care physicians, and dentists, and she answered all of the questions better than any of them. So that stuff is drilled into you, you know it very well. Also learning facial structures and helping you learn certain areas to avoid. For example, placing local anesthetic into the parotid gland can actually cause facial paralysis. So we are dealing with some things that have a pretty high risk, so we need to know a lot. Nutrition is also huge. Like I said, we educate your patients, and then it's also a really big part of your boards as well. Bachelor's programs require you to take a class called biostatistics, which is just kind of a scaffolding, another level on top of intro to statistics. But you basically are able to read a whole study and understand, like, this wasn't a very effective study, or this was a very effective study. Also things like the chemical structure of fluoride. Also knowing how the body works to understand everything later. And then also understanding the physiology and growth of soft tissue, because you do learn in embryology how all of that is formed from the 3 layers that come from the egg when you're developing as a baby. The other thing I wanted to add, if anyone is interested in going anywhere outside of Utah for dental hygiene school, is something called a CODA accreditation. What this is, CODA is the Commission on Dental Accreditation. What that is it is the big, maybe not the big bad, but the big guy who's in charge of everything. Most states require you to graduate from a CODA accredited school. I know Alabama's not that way, and a couple other states as well. So there are some programs that are not accredited. If you do graduate from a CODA accredited school, there's a 92% chance that you pass your NBDHE. If you graduate from a non-accredited school, that number goes down to 62%. So something interesting to add, they teach you, just because they have certain standards that are required. At the end of almost every single one of my assignments, there's a CODA accreditation number for how this is going to teach me a certain thing. So all dental hygiene schools in Utah are accredited by CODA, which is a good thing because I think it's required to become licensed in the state. They do have accredited dental assisting schools, but in Utah it's not required to graduate from a required a CODA accredited dental assisting school, so most of them aren't CODA required. MTech is not, but that doesn't mean that you're like not officially a dental assistant. And then if you go into any other major besides dental hygiene, almost all programs have some type of accreditation. I know mechanical engineering is that way, and just if anyone's interested in any other types of degrees, just making sure that they have some type of accreditation so you're not going through all of that work for nothing. And then applications, I know you guys talked a lot about things that you were really interested in across schools in Utah. Most of them are the same with just kind of slight differences. The most important one in most of them is your grade on your science-based courses. These are things like anatomy and physiology, chemistry, nutrition, things like that. Those are normally some of the most important ones. It's kind of ranked at the highest because dental hygiene programs get such a large amount of applicants. I think there was almost 100 when I applied, and they have to go through them really fast, so they normally do like a number system. Normally you have to take some form of a critical thinking or a science-based test. I had to take the HSRT, which was a critical thinking one, to make sure that I could critically think enough in the dental hygiene program. Or some might require you to take the HESI, which is one that a lot of nursing students have to take to get into their programs, but it's just kind of a test on all those classes that you've taken. Sometimes they'll use essay prompts if there's like 5 of you that all scored about the same and you're number 24, like trying to figure out who's gonna get it and who's not. They'll read your essay prompts as well as your letters of recommendation. When I wrote mine, I had Dr. Proctor write one for me, and I also had an old volleyball coach write one for me. You had to have a professional one and then a more informal one that was from a non-family member adult, so I picked one of my volleyball coaches. Also, they want to make sure that you have previous experience. There are some people who are terrified of saliva. I don't know why you would ever pick dental hygiene if that was the case, but if you do spend some time as a dental assistant or you have maybe 50 observation hours or so, you can figure out if you're afraid of saliva or not. And then also, if you're not currently a student at that university, you do have to apply. And then the next step is you cross your fingers, your toes, your eyes, your legs, all the things. And hopefully you get into the dental hygiene program where if you're at Utah Tech, you make 23 automatic best friends because you spend your entire time together. I think Weber is a little bit different. I think you do kind of alternate between classes. But at Utah Tech, you take all your classes together, you go to clinic together, you go to every single one of your classes at the same time. The next one I'm going to talk about is a little bit about dental hygiene school. I actually had my advisor before I got into the program tell me, oh, don't worry, getting into dental hygiene school was the easiest part. And this is a very long story about all the times that I've been humbled and found out that that was not true. I remember thinking like, oh, I'm a dental assistant, it'll be fine. This is going to be easy. Then I got into dental hygiene school and I was like, oh, this is why I need a degree to do this. I understand now. Just a little bit about the school as a whole. A full-time student at Utah Tech, sometimes credits differ slightly, but to be a full-time student at Utah Tech, you do have to take 12 credit hours. A dental hygiene student, I'm currently taking 14 credits because I'm a little bit more involved in clinic right now, so it kind of makes those numbers go down a little bit. You take anywhere from 14 at the lowest to 21 at the highest. And depending on the school, sometimes you don't get to pick how many classes you take. So like for example, I went to class with every single one, so we all took 21 credits together. We all went to class 1, class 2, class 3, all together. Dental hygiene is really rigorous where you're required to be there every single day. The one day that I missed, I had to bring an obituary to prove that I was going to a funeral. So they could make sure that I was actually gonna show up. You can expect to be in school about 8 to 5 every day, and then I would normally study for a few hours after school or on the weekends because I'd have tests on the weekends as well. For me, the hardest semester was the second semester I was in dental hygiene school because that's when you start seeing patients, and it's also when you're taking that 21 credit hour class. These are just a list. This is at least at Utah Tech, some of the classes that you take. I know UVU is a little bit lower because it's not a bachelor's program, but it really depends. Most of them you do have to take. But semester 1 you take oral anatomy and histology, which is the growth of a baby in the womb. Radiology, you learn how to take x-rays. You learn like really specific things about like how to get the contacts open, making sure you get 2 millimeters of bone across any PA or bite wing you take. Your premolar bite wings always have to have the distal half of the canine, otherwise it's a retake, which is a drop in your grade. Medically complex patients, this is kind of the base level for all of your medical stuff. The very first day I was in medically complex, I had a very strict teacher when she taught that, and she got up in front of the class and she said, if you know anyone in nursing school who's starting right now, you will know more than them. It's very rigorous, they teach you a lot. As well as tooth morphology, I remember writing did you guys have to do the posters that you did? That's what I had to do, where it's like, here's the cementum, here's the alveolar bone, all of that. It's just a little bit more involved, as if you picked up a tooth and looked at it, you could say this is number 19, or whichever tooth that is. Dental hygiene theory, that's just kind of like dental hygiene 101, just learning about the basic things, like how to read a probe, all that stuff. And then clinic. Pre-clinic is when you start to work on each other. And then you move on to that next semester, that's where you kind of start to build off of the classes that you took. You take pharmacology, which is your classes on drugs, microbiology, which is the bacteria inside your mouth. Pain control, this is where you start to learn how to give injections and you get to practice on each other. It's really fun. But in dental hygiene school, you never do an injection with an instructor not standing next to you, or a doctor, either of them. They are very strict. You have to do everything a certain way, and they'll correct you if you do it wrong. So it's a little scary, but trust me, it's actually a lot of fun. Dental hygiene theory kind of builds on top of that. Clinic 2 is when you start to see your live patients. You are responsible at any school in Utah, I think. Maybe Weaver's different. You are responsible for finding every patient in dental hygiene school.
What happens if you don't find a patient, Sage?
You get in trouble. I've had times where my patients cancel at my school. At UCDH, I know if your patient doesn't show up, you lose half your points for the rest of the day, whether it's your fault or not. At my school, it's not that way because our grade starts from a negative 27% and you have to build up from that. So that's why I don't get docked. But if I didn't find a patient, I get what's called a CMPJ deduction, which is an automatic dock on my final grade, no matter what. But the first semester I had to find 7 patients. The second semester I had to find 9. And then the last one I had to find 14, which is what I'm in right now. And I currently have 18 patients. And some of them I see multiple times. My very first patient is the guy sitting back there. He is my husband. He was also my first patient here. Don't worry, I asked him if I could say that. He was my first patient here at MTech, and then he was also my first patient in dental hygiene school. It took me 12 hours to clean his teeth the first time. And now I'm seeing him next month, and I will clean him in an hour and a half. So you get a lot faster, you get so much practice. The other classes you take is periodontology, learning how to diagnose periodontal disease, and then dental materials and lab. This is the one that I feel like is the most like dental assisting school, just because you take impressions all the time. I remember in dental assisting school, I think we took impressions probably at least once a week. We did it a lot. At my school, you do have to take class over the summer. This is just some online classes like biostatistics, leadership, and research methodology. All of those classes bump me up enough that I can achieve a bachelor's degree. I think in order to get a bachelor's degree, you need like 125 credits. To graduate with an associate's degree in dental hygiene, you need like 120. So a associate's degree really isn't that different. You take like 3 more classes. The 4th semester, you do clinic again. You're a little bit more focused on getting those patients that are really periodontally involved. Most of my patients I'm from Honduras. I've never had my teeth cleaned before, things like that. Advanced theory, building off of theory again, is where you start to get to go into the community and teach them. I've taught CNAs and elementary school kids and special needs students as well in the middle school. Oral pathology is where you learn about oral cancer. That one we'll talk about a little bit more. Ethics, just like the ethics of a dental hygienist. Like for example, in Utah currently, a dental hygienist cannot give local anesthetic unless the dentist is in the building. That's not legal. Even if they're 5 minutes away, it's not legal for them to do that. Expanded functions, this is where you start to work on a typodont and you get to practice how to do those restorations, and they're checked either by a expanded functions trained dental hygienist or a dentist as well. We have a lot of old retired dentists who like to come hang out with us for that day. The final semester, the one I'm in right now, is Clinic 5. This is where I complete all of my requirements. And public health, you learn how to run a public health program, because that's actually a job that you can have. That's one I didn't know that existed. Senior project, what I'm doing right now, I come and present to you guys. Community again, theory again, and expanded functions again. All of that kind of teaches you the final parts of being a dental hygienist. Do any of these surprise anyone? Or make you nervous? How about that one? Probably pain control. I remember being really nervous the first time that I did it, and I think I was like shaking when I was giving the injection. My poor friend Oakley, who had to be the one, but then she did it to me. So you just switch off and you do it again. You do get to give each other nitrous sometimes in pain control. That's the fun part. But every single person is terrified to go into their pain control lab, and so you practice on a typodont before you ever do it. You practice on a tomato, I think is what I did the first time. And then they just throw you right in. But dental students, they give them a little PowerPoint about as long as I'm giving you, and then they go, okay, go poke each other. I'm not gonna watch you. I'm not gonna do anything. Just go. There's actually a version of the University of Utah. They take about 5 students down per week at Utah Tech, and I get to watch them give injections, and they're not very good at it. For example, like in IA block, you have to be at this angle. They'll do it at this angle. Or this one, they'll do it at this angle. And they won't go to the correct angle, and most of the time, their patient gets numb anyway. So, dental hygienists are better at giving injections than dentists. Maybe that's my unpopular opinion, but
I
you're
agree.
trained on it more. There. Natalie agrees with me, so it has to be true.
Sage, going to your semester 2 when you had to start seeing patients, how was that? I mean, 'cause in here, you usually gotta bring people that you knew quite a bit, right? In that, did you know every single one of your patients?
I did not. I knew some friends that I begged and begged and begged to come in. For example, my husband, his best friend, I begged my mom to come down at one point because I was like, I can't fit enough patients. Can you please come and be my patient? The number one way I've actually gotten patients is through referrals. I was sitting at the front desk one time trying to figure out some stuff. I think I was making a chart or something. And this family walked in and said, hey, we only speak Spanish and we need someone to clean our teeth. And I said, I will do it. I speak Spanish. And so that's where I've gotten most of mine. I put a little flyer in a little Spanish market. That also helped as well. But yeah, I've mostly gotten it from referrals like, hey, could you clean my husband's teeth? Could you clean my sister's teeth, my neighbor's teeth? Most of that. And when you explain to them the importance of that, it also helps a lot. My school does do something called screening appointments where the girl at our front desk schedules those for us. So you just kind of get a wild card patient who calls in and says, I want my teeth cleaned, and they get put in our screening appointments. But yeah, a lot of patients, what's really hard is I'm not from St. George, so a lot of my patients, I had to find new people. We had like a list of patients who were like, I'm interested, okay great, I'll put you on what's called our call list, and our students will reach out to you. I also, kind of like a sorority, how you have a big and a little, I had a senior and a junior, and she kind of gave me some of her patients to be like, hey, these patients are really reliable, they'll actually show up. And so I've cleaned about 3 of her previous patients, but that's kind of how I started to do that. Your first semester, you're just trying to get anyone to come in, you know, your friends, because you're wanting to do those slightly easier patients. You're not wanting to do someone who's like heavily periodontally involved. Your second semester, that's when you really do want to see all your periodontally involved ones, because you have to see a certain number of stage 3 periodontitis. You have to see a certain number of stage 2, stage 1, stage 4, all of that. You have to see a certain number of geriatric patients, certain number of teenagers. If you guys really want me to, I'll show you my requirement sheet and what it looks like. It's really overwhelming a little bit, but yeah, so most of my patients that I'm seeing this semester are periodontal maintenance from what I did the last semester or before that. So, you know, I don't have to find 14 new patients. I can re-clean certain patients. My very, very nice husband there has had his teeth cleaned 3 times now, and he will get them cleaned 1 more time again at the end of the semester. Clinic, this is the next activity we're gonna do, just talking about that a little bit more. So your pre-clinics, you get to work on each other and you practice on each other. This is where they're just like, okay, just probe their mouth, just use your Explorer, and you have to pass certain competencies to make sure that you are doing it well enough to do it on a patient later. So clinic starts with you working on one another. This is before you see any live patients, and they're very strict on learning your basics. The basics of dental hygiene, especially like how you even hold your instrument, is super, super important. If anyone is ever struggling in my class with, let's say, exploring or calculus detection, they'll make sure that their grasp is important first, and also that they're fulcruming correct, all of that. So I'm gonna teach you guys a little bit about the proper dental hygiene grasp. It'll be a lot shorter than what I learned, because they taught me this for 2 hours before I was even allowed to put it in a typewriter. But this is a picture of the dental hygiene grasp. This is a probe. It can be used on basically any instrument, but you can see that the index finger and the thumb make a C right there, and this allows you to be able to roll your instrument so you're not putting any instruments into the gingiva. Your next one, the important thing is that all your fingers are together as well, and so then you're not causing strain on your fingers by stretching them. So your next finger, your middle finger, is going to be placed on the shank right here, and what that will do is it will allow you to detect anything on your fingers. this, especially like calculus detection, will make sure that you're able to detect anything under the gums. Really fun about dental hygiene is we do most of our work blind because you can't see, so most of it is actually based off feel. And then in dental hygiene, our fulcrum is actually our ring finger, not our pinky. That was something that actually took me a minute to learn. But the reason that we do this is because when you're scaling, you're actually applying a lot of what's called a lateral pressure with your thumb. And in order to do this, you have to have a really strong fulcrum. If you do not have a really strong fulcrum, you can slip and cut your finger. I know from experience this happened to me 2 weeks ago, and I got to spend a lot of time in work med, and it's not a fun time. I would not recommend it. So a strong ring finger fulcrum is also very important. I want everyone, I put an instrument in front of all of you. I'm gonna have you try your dental hygiene grasp. Make sure that we're doing it right. Then you're able to move your instrument around. My nails are longer than they've been in a long time. They're very strict about having short nails.
I
Except
was
for
gonna
Weaver.
ask that.
Yeah, my nails are too long right now. I definitely would have been sent home. But
So they will send you home if your nails are, like if you have.
I've never
really
been
big-
checked.
Mm.
And once you're a senior, they don't check you quite as much. But if they're like, they're really struggling with scaling, they might look at you and say, well, your nails are too long. You need to go cut them. So
Wow.
that's what that is. I know in Weber, you're actually allowed to have nails your senior year. And when I found that out, I was shocked because they're so strict on not having nail polish, clear nail polish, acrylic, anything like that.
Does it make a big difference? Or is that just like
So the reason that they don't want long nails specifically is they don't want dirt getting underneath the nails, and they also, if you're fulcruming on soft tissue and your nail is digging into their gingiva, it can be uncomfortable. So sometimes when I was a junior, that's when they were the most strict on it, but they would take my fingers and take my hand like this and say, I can feel your nail, it's too long. Which I never got them that short, but that's what they told me at one point. Alright, I'm gonna check everyone's hygiene grasp. Good, and we wanna have a nice C, so then we're not stringing your finger like that. Great. And then are you able to roll your instrument? Yep. Perfect, and then a nice little C like that. And same thing, nice round right there. You don't want it to be, they call it duck billing, where it's like this. You want it to be nice and round, so then you have more flexibility in your finger. Yeah, and then you want your fingers to be touching and more like a line like this. Good job. I know, it's really strict, isn't it? You wouldn't expect that. Great. Yeah, that's good. Your nails are too long anyway. Sorry.
Send me home.
Yeah, and then you wanna make sure that they're all, your fingers are all together and touching, so then you're not straight by stretching them like that. Perfect, that's great. And then we want your fingers to be straight, just like that. And then I'm able to move. Can you have them a little bit further apart? Because if they're too close, then you can't roll. You want them to be like parallel. So this way. Oh, that's great. Maybe a little bit more on the left. I know, it's really strict, isn't it? I remember the very first day that they taught me how to probe, I remember going in and being like, yes, I'm gonna learn how to probe. And then I spent 2 hours holding my instrument. And I put it on a little wood block like this, and I had to move my hand like this, like tiny little movements, just like that. I think I sent him a video that day, and I was like, we've been doing this for almost 2 hours. I'm exhausted, and I know, but I'm very glad they were that way, because now my hand doesn't hurt. I'm not gonna get carpal tunnel, hopefully, but some of them are very strict about that. Does that surprise any of you? Did you find anything surprising?
It's just crazy how strict everything is.
It's very, very strict. I've heard this may not be the case for everyone, but one of the dental students who visited us in St. George actually went to dental hygiene school first, and we were like, okay, you gotta tell us what's harder, dental hygiene school or dental school? And she said, dental hygiene school, absolutely. I really don't want to scare anyone away by that, but you become a very competent clinician in any school that you go to, and you feel very confident by the end of school. Yep, I remember, I kind of mentioned most of this already, but I learned at my second week of dental hygiene school and they spent over an hour just teaching me how to hold the instrument. They were very strict on it. There was 5 instructors walking around the room correcting us. It does sound like a lot, but if a student is ever struggling, the first thing they'll look at is their grasp and anything else involved. One thing that I did want to mention is oral cancer screenings. Has anyone had an oral cancer screening done on them before? Good. I'm very glad Natalie said that she has. You better raise your hand too, because I've done it. But an oral cancer screening, this is a quick screening of the head and neck. We'll do extraorally and then intraorally as well. What this does is we are just checking for anything that is abnormal at all. It is one of the most important parts of preventative care for a dental hygienist, and it should be done at every single dental hygiene appointment. I don't care if you go once a year or 3 times a week. It should be done every single time. If I miss something on because I have to see patients for multiple appointments sometimes, if they had something and then the next appointment they have something else, I can actually lose points because I didn't mark it on there. The reason that they are so strict on this is 50% of patients who are diagnosed with oral cancer will be dead in 5 years. That is a lot higher than most things. I think that's more risk than breast cancer. Obviously the more intense ones are higher than that number, but it's really high because there's so many lymph nodes around that area that cancer can get into the lymph nodes and then it metastasizes or spreads to the rest of the body. I put this picture in because this is what we are palpating when we do an extraoral exam, but you're just going around the sternocleidomastoid. There's anatomy again. You're palpating around those muscles to feel for those lymph nodes to feel if any of them are abnormally large. We're just kind of watching for anything that's abnormal. A story that one of my instructors once told me is she had a patient who came in and she was super sensitive to anything involving smell, like you had to unplug every single wall outlet. She was the only one who could clean her teeth because she didn't have a fragrant detergent. She kept saying that there was something on top of her head, and she was like, I wonder what that is. You really need to go get it checked out. She's like, I really want to, but I cannot go into a doctor's office. They smell too strong. She thought about it, and she's like, I think whatever's on top of her head is pushing on her brain and causing those differences. She never got to find out if she was right or not because she was supposed to see her next week, and she ended up passing away of a brain tumor. So that is one story that one of my instructors have told me that's very important. And you could potentially save someone's life. There's a lot of things that are warning signs in the mouth that would be warning signs for other things in the future. I hope this doesn't gross anyone out. I showed these slides to my family and they were disgusted. I want you guys to look and see which one of these do you guys think is oral cancer? Top middle? Anyone else?
Maybe the one that's right next.
This one? So the correct answer is all of these are signs of oral cancer. This is something called Kaposi's sarcoma. What that is a cancer that is really rare unless someone is immunosuppressed. So this is actually a warning sign that someone with HIV has transitioned into AIDS. And then this is like an HPV lesion as well. I didn't know most of these when I was looking them up, and I am now forgetting them, but these are just things that would be abnormal that we would want to get a biopsy of. This shows a lot of the most important places that oral cancer is found. The most common ones are on the lateral borders of the tongue right here, on the palate or the back of the throat, and then also just making sure we're still even checking places like the cheek, because even if that site is a lot less common, it's still possible. The number one thing that patients want to look out for is anything that is red and white lesion, because that is a warning sign that is something called squamous cell carcinoma, and that is the most common type of oral cancer. So just always making sure you can even teach your patients how to do that themselves, like just checking for anything that's abnormal, anything that doesn't heal in less than 2 weeks, because we know we get like canker sores and things like that will normally heal within about 2 weeks, or a cold sore, things like that. But just informing your patients or your family members, because this is very important. It's probably one of the most important things that you learn. Okay, next slide. Which of the following do you guys think is oral cancer for all of these 6? these are tricky on purpose.
Bottom right.
The bottom right. Correct answer is actually none of these. Some of these can become cancerous lesions. Most importantly, the one on the bottom right, you guys are close. That one is what's called a smokeless tobacco patch. It's hyperkeratinized tissue, so it's gotten thicker from having a patch or Zin in that area for a while. A lot of people think that Zins are different. It's still irritating the gums. It still has nicotine in it, which suppresses your inflammation. But that's why we also recommend if anyone is a tobacco user that they move that spot in the area, so then it has just less constant abrasion on that area. This right here is something called primary gingivostomatitis. What that is the first time that someone is someone is exposed to a herpetic lesion or herpes or cold sore, they can get something like generalized in their mouth, all across their mouth. They normally get a fever, they feel sick, and their whole mouth is covered in sores, almost like sores. This is why we don't kiss babies, because we don't want to give them this, especially when they're little. This is extra painful. It's most common in children. This is something called a pilus fissuratum. What that is the denture does not fit properly, so the tissue actually starts to overgrow to try and fill that area as well. This is geographic tongue. Does anyone know what geographic tongue is?
You guys all better know that.
Good job. I actually used a laser on some patients for this to almost like a red light therapy to help them. This is an irritation fibroma. I remember I saw Dr. Dorius take one of these off before, but it's just like they constantly bite on a certain part of their lip and it becomes like thick scar tissue. And this right here is called nicotinic stomatitis. What that is when a patient smokes, it can be vaping or normal cigarettes. I think it's most traditionally regular cigarettes, but they breathe in that smoke and it actually can burn the top of their mouth and cause this like overgrowth of tissue to try and protect it, again, that keratinized tissue again. And this actually does go away when the patient stops smoking. I do have a patient right now who stopped smoking about a year ago, and he, it's visible, but it's not quite as common. But I was able to look in his mouth and I said, "Did you used to be a smoker?" And he's like, "Yeah, I did. I stopped smoking about a year ago." I was like, "Yeah, I can tell, because this is in there, but it's actually getting a lot better." Okay, the final objective that we have is something called motivational interviewing. This is a part of educating our patients where we talk about making it so they're a little bit more involved in this decision. I'm not just gonna sit there and tell you that you need to floss. They know that they need to floss, but if they make steps toward wanting to change, or they have something that's better for them to be able to floss, it can help them a lot more as well. Has anyone ever used motivational interviewing before? It's okay if you haven't. I didn't know what it was until I was in dental hygiene school. But I want to talk about first the most important part of any type of education for your patient is knowing your patient. Making sure you're educating on something that will actually listen to. I included Maslow's hierarchy of needs. This is a theory about the brain, about how we cannot act a certain way if we don't have our certain needs met first. So, for example, like food.
I didn't get that. Could you try again?
Food, exercise, and sleep. If your patient is like struggling to survive, they're not going to be thinking about things like, "Oh, I really do need to see a periodontist for periodontal surgery." That's not important because they can barely afford food. And then as it gets up and they get more and more of their needs, they become more of their own personal selves and they express more self-esteem. Things like, friendship, acceptance, love, things like that. A really good example of this is if a patient is struggling to brush their teeth 3 times a week, don't try and get them to floss every single day. We want to make those attainable SMART goals. Does anyone remember SMART goals? I think I remember learning them in middle school. Yeah, making sure that we have something that's attainable for our patients is super important, because if I'm just going to tell you like you really need to floss every day, they know that they should. They're still not going to do it every day. A really good example of this is I had a patient one time, and I asked him, it's something called a readiness ruler, but you ask McCall, it's my husband's name, on a scale of 1 to 10, how much do you hate flossing? Tell me what you told me that one time.
I told her a 9.
Why is it not a 10?
My answer was because if somebody was holding a gun to my head, I'd floss.
I said, and I asked you, why is it not an 8?
Because I have big hands, so it's hard to like
Yeah.
get the floss back in the very back of my molars.
Exactly. So what we were able to do through McCall and through learning about him, we learned that it's really hard for him to get his fingers all the way back in his mouth. And so what we actually gave him instead was a floss pick that has an extended handle. Listerine makes them. It's almost like a toothbrush handle with a floss pick on the end. And that allows him to be able to reach all the way back because his big man hands don't have to get in his mouth. And that actually, he has flossed a lot more and is doing a lot better. Do you agree? Do you
Yeah.
like using it more?
Oh yeah, it's way better than
Yep.
string.
Yep, and so the most important thing is listening to our patients. If our patients are struggling with something, giving them empathy and saying, I'm really sorry about that, and making sure that those patients feel listened to and feel like there's a different avenue that they can learn from. Especially with interdental aids like floss and stuff, there's so many different ones, and some of them work even better than flossing. Okay, the next activity we're gonna do is a tell, show, do activity. What we're gonna do is, this is another example of things that we can do to help teach our patients. So you tell them how to do it, you show them yourself, and then you have them do it and you correct them. So I have floss on everyone's table. What I'm gonna have you do is take a piece and I'm gonna have you teach your partner how to C-shape floss. You're gonna say, can I teach you about flossing? You'll say, no, you wanna
You
make sure
guys
you
better
have
be
your
pros
index
at
fingers.
this.
You wanna make sure you're wrapping, hugging around the tooth, then moving up and down, you're not seesawing once you're in that interdental space, things like that.
Yeah, I can't do it.
Sorry, I did not get the right kind of floss, that's my bad.
It's
Floss takes.
Trying to Delaney.
Yeah, I got some.
Yeah.
Oh,
Yeah, I did. And then we're gonna go T. Then you're gonna snap it.
Sage.
You want to seesaw like this. Then you create a C shape. Bring it up. And then
You
do
can
the same thing
resend
again.
She this is her keys. She always has floss on her keychain.
here, I have this for you.
Yeah.
Which does come in handy when you don't have like
Yeah,
a
you're
big
welcome.
Just the back part, say your
I just know this thing, I have to turn it.
Oh! Turn one of these and go up. And then you want to get it on both sides. That, like, you want to turn
I knew it. I told you. Alright, did anyone find that a little bit awkward? Yeah. One thing is, you guys all know how to floss. One thing that I actually teach all my patients is proper brushing technique. I've actually found that basically no one does it correct. That's one thing that I use Tell, Show, Do for a lot. One time I was instructing a guy and he had so much calculus in his mouth, I could see it from when he was talking to me. And so I sat him down and I tried to very nicely ask him, are you brushing your teeth? Do you know how to do that? Turns out he was brushing the lingual sides of his teeth. So just making sure that our patients are fully informed, and if they do it themselves, then they're able to make that connection. And if they make anything, and if they do anything wrong, you can correct them and say, actually, you do want to hug that tooth. You don't want to be putting pressure on the interdental pillow right between those teeth. So things like that. I know educating people can be a little bit awkward, but just making sure that we are informed about what, because you will always know, you will know more than your patient 99 times out of 100. So they're there, they want to get better normally. So being there to be the one to educate them is really important. That's, I believe, a part of a dental assisting's job too. It's not just the role of a dental hygienist. That's why I wanted to bring it to you guys, because you guys are involved with your patients just as much as dental hygienists are. In some ways more, because you might see them for maybe some more appointments and things like that. Does anyone have anything that they're currently working on while educating patients? Something that I'm working on is those really closed off patients, trying to get them to open up. I feel like a lot of them, I'm like, do you floss? Yeah. Do you know how to do it? Yeah. Okay, can you show me how to do it? One thing I'm working on is something called a teach back method. And what that is if I've explained something really complicated to them, especially periodontal disease when they don't even know what plaque is. Like, so you actually do have something called periodontitis. Having them teach it back to me, I found is very effective, because then I can say, okay, can you give me a summary of what you've learned? Because I know this is a lot of information. So just talking about something like that can be really important at times, to make sure that they're really understanding everything else. Does anyone else want to share something that they're working on with education?
Probably just being like confident in myself that I know what to do.
Definitely, yeah. And just understanding the knowledge that you probably know more than your patient. Even if you are still in high school, you guys have spent so many of these hours learning about dentistry. You've learned so much. Like, what are you guys learning right now? What topic are you guys on? Like cements and stuff? Yeah, like teaching your patient, like, hey, maybe don't eat bread for the next little while, because bread really likes to take that out. They don't know that. And so just educating your patient, or I got asked the question a lot when we do fillings, like, can I eat right away? And it's like, yeah, you can. That's cured, we cured it with light, all of that. So you do know more than most of your patients. Obviously, you'll run into the random person who was a dental assistant before, so they might know. And sometimes I saw a dental assistant once who went to school like 50 years ago, and she wanted to impress me by calling it a panoramic instead of pano. And I was trying to explain, hey, we cannot take out your broken implant. Like, someone else has to do it. And she didn't understand that. So you do know more than your patients. You guys have the most up-to-date knowledge right now. So the last one I wanted to talk about is something called adjunctive periodontal therapy. A lot of you guys in that survey I sent out talked about being interested in that. What adjunctive periodontal therapy is? My computer just died.
Oh no.
What adjunctive periodontal therapy is the type of is something that we can do in addition to periodontal therapy. What that does is it helps increase the likelihood of attachment. So one thing that we can do is laser. I've actually gotten it done on me a few times. I was a dummy when we all got laser certified in school. But what that is it's pretty similar to red light therapy. And what that would be is the patient will come in, and it's almost like a probe tip on the end of it. And what that is the patient will, it's just placed in the gingiva, and what it does is it can help stimulate blood flow to the area, and what that will do is help bring that new blood flow and help out with that. And the other one that we have is something called air powder polishing. Does anyone have an air powder polisher at the office they're interning at? It's kind of newer, so it's not super common. It like sprays air and water. I know most people normally still use the rubber cup polishing, right? Yeah, that's pretty common, but it's actually within the dental assisting scope of practice to do that. But what it is it sprays air and water and powder, and it uses an abrasive. It's either glycine or sodium bicarbonate. And what that does is it removes biofilm better than anything before. So the best one is air powder polishing. The next best is ultrasonic, and then the next one after that is rubber cup polishing. I know all of you guys are really good at rubber cup polishing because you do it a lot, but the most important thing is that when you're using it super gingivally, which is above the gum line, that it's not pointed directly at the gingiva. Because if it is pointed at the gingiva, that color can actually go into